healthcare workers have carried, there's been a lot of mental stress. They've carried a heavy burden during the COVID-19 crisis, and in the challenge to control the virus, have directly faced its consequences, mounting deaths, long hours, isolation, lack of resources, and the risk of contracting COVID-19 has led to mental health disorders like anxiety, stress, depression, and other psychological issues. To talk about the psychological impact on the frontline workers, we have with us Captain Usha Banerjee, Director of Nursing, Apollo Hospitals, Jitinder Singh Shanti, Shaheed Bhagat Singh Sevadal, and he's a Padma Shri awardee, Dr. Prashant Saxena, Director and Head Pulmonology and Sleep Medicine, Max Smart Hospital, Ranjan Dora, Volunteer, India Shield, and of course we have Mr. Dilen Gandhi joining us for this panel. And we also have with us a very special guest, Masaba Gupta, who's going to be joining us as a co-anchor to steer us through this hour. Thank you, Masaba, for joining us today.
Thank you.
My first question to you is, Masaba, the pandemic has forced us, out in the open. It's been really tough on each one of us. Issues related to mental health have come out even more now. Even if, people aren't suffering mental health problems, they're certainly somewhere they're fatigued, right? Because of isolation, the worry, the uncertainty. So how have you coped with this in the last 2 years?
So, Ambika, I feel like isolation is a very charming thing for the privileged, but not a very happy experience for those who aren't privileged. And I think that for me, the last 2 years have been tough, but very liberating at the same time. I think being a business owner, we're a small business. We had not just my own personal problems to deal with in this time, but also the problems of all the employees that that kind of are attached to you. Yeah. And I think while you want to make sure that you're taking care of your own well-being, I think it's also important to keep in mind that your employees go with you, and it's important to think of their mental health, their state of mind at the time. And we were working through the pandemic, but I think for me it was a period of I internalized everything in a way, and for me it was a period where I discovered so many things about myself as an entrepreneur, as a woman, as a daughter, and also as to how I want to lead my life. But I think I come back to the same point that I had the privilege of being liberated through my isolation, but a lot of people I know didn't feel that way. But I think it's also been, I wish it came in another way to people, but it's been a very, very important time for all of us, because I think we've become kinder. For sure. We've become kinder to one another. We've become a bit more aware of what the other is going through, about mental health, which is and was such a big taboo in this country. That I feel like today people will openly come out and address their problems instead of putting them under the carpet, which I'm very, very happy about in a way.
Definitely, we're talking about it much more.
Yeah, absolutely. And I think, more importantly, Ambika, I feel like today you have girls who are 18 as well as older women who are equally talking about their mental health issues. And I think the most important thing that has come out of this pandemic is that everyone has now set their own boundaries, when it comes to mental health. And I think that that's a big part, plays a big part in how we all define our mental health, what boundaries we set around us. So I think that's a great takeaway in the last 2 years.
And it's impacted everybody, from the senior citizens. I mean, it's not left anybody. So I'm glad we're talking about this during this hour.
Yeah, absolutely. And in fact, I was talking to one of the doctors at a hospital the other day, and which is why my next question was to Mr. Saxena in just a minute. But what I noticed was that I've never seen a doctor not happy or not bright or not positive. I've always, And now I saw this woman who looked like she had been defeated, and she's a senior doctor, and which is why I started to think about, we can talk about our mental health being on the other side, but what about these guys who are on the front line?
And they have to
which is why my next question is to Dr. Prashant Saxena. Doctor, while helping patients is always something that's, on your mind at all times as a healthcare worker, is it possible that doctors aren't looking after themselves through this whole process? And I feel like what this pandemic has done is that doctors are working overtime, they are away from their families in some cases, they have had loss of all kinds, and they really don't see the end of this anytime soon. So how do you think medical workers are coping with this very, very trying time?
Yeah, so thank you for the question. If we talk about medical profession and being a doctor, I believe it is one of the most physically, mentally and emotionally demanding profession. And one has to be good in all the three streams. Otherwise, you cannot be a good doctor. But this COVID times tested us really very well, because the second wave came as a shock. It was unpredictable. We were not prepared. We were prepared, but not fully prepared. And there was a lot of stress and anxiety, primarily because there was a concern about our own health. Then there was a concern about our family members. There was a concern we can transmit our infections to the family members. So we were repeatedly going on quarantines and we were socially isolated. So we had to live in different houses. And not only this, those people who were living in societies, there was a lot of social stigma. And because some of the societies even banned the entrance of healthcare workers. So a lot of factors were playing at the time. Depression and emotional disturbances, because as you said, we had loss of many doctors, many colleagues whose lives were lost while battling against COVID. And there was a burnout, complete burnout, because at one point of time, I was seeing close to 100 patients, 150 patients on OPD basis. And there was no time left for me to sleep. There was insomnia, there was exhaustion. And I believe there was an excessively overburdened healthcare system at that time. But I believe we strongly came out. We had to be strong because there was no way we could have been weak, because the enemy was very, very strong. And finally, in our delight, the COVID epidemic ended and we were saved. A lot of lives were lost, but in the end, we did well and were able to manage our patients very well.
Dr. Saxena, just one question that popped up right now. Experienced healthcare workers and doctors obviously are very well equipped in a sense to, not really, but better equipped, I would say, to deal with something like this as opposed to the younger healthcare workers. And I want to talk a little bit about that. What happens to all these young aspirants who've wanted to become doctors and nurses, and they've just been thrown right in the middle of a raging pandemic? Can you shed some light upon their mental state through this time?
I didn't get the question. I didn't get the question.
Could I, am I audible?
Maybe you can repeat.
Can you hear me now?
Yeah, I can hear you now.
So, Dr. Saxena, my question was that, of course, you have a lot more experienced healthcare workers and doctors who've been in the profession for many years. They're a bit better equipped to deal with a pandemic like this. But what happens to the younger healthcare workers who have been thrown right in the middle of a raging pandemic?
Yeah,
what happens to their mental health?
Yeah, a very important and a very valid point, because most of the frontline workers, including the doctors, were very young. They were not experienced in handling the situation. But I think the role of senior doctors and clinicians was very important at that stage. And we were the ones who were constantly trying to encourage them. We were trying to build up their emotional morale, and we were trying to help them as far as possible, trying to talk to their families also, because the families were also very apprehensive because they had no idea what sort of duties their kids were doing, and there was always a fear that a life may be lost. So it was all a team effort. There was a lot of emotional support. There was a lot of bonding which happened between us. And in fact, it was a remarkable effort put in by a lot of administrative colleagues also, which helped us. So it was a battle which had to be fought together. And the younger generation had to be emotionally and physically and mentally, all the aspects we met up, and we tried to help them in every corner.
Thank you.